Good evening, students. So today we are going to discuss a very important reflex called Bainbridge reflex, right? Now, why exactly the Bainbridge reflex is clinically very important? Because you are actually going to see it firsthand when you will join your internship, right? That as soon as you give IV fluid to a patient, the heart rate of the patient increases, right? So how exactly the Bainbridge reflex works, right? That we are going to see. Bainbridge reflex. Right? So how it starts? Okay, you give IV fluids. Okay. These IV fluids, where they will go? They will go in veins, right? And all the veins, where they are ultimately leading to? They are going to right atria. Let's write in short, right atria. Right? Now, these right atria, because of filling with the fluid, is going to stretch, right? And it is going to stimulate low pressure receptors. Right atria stretching, and it's going to stimulate low pressure atrial receptors. Right? Right atrial stretch. Okay. Once these low pressure right atrial receptors get stimulated, they are going to send signals to two pathways, right? One of their signal will go to inferior cervical sympathetic nucleus, right? Inferior cervical sympathetic nucleus. Let me sympathetic nucleus. Okay. So up to the stories, the IV fluids, they go in veins. The veins are going to stretch the right atrium. They are going to stimulate the low pressure atrial receptors. Two pathways are there. One of their pathways will go to inferior cervical sympathetic nucleus, and that is going to increase your sympathetic outflow. This will increase your sympathetic outflow. But this pathway is not of major importance in Bainbridge reflex, right? The pathway which is of major importance in Bainbridge reflex is one of the pathways will go as vagal afferent, right? Vagal afferent. Right? This vagal afferent will go to the medullary cardiac center. Right? And this medullary cardiac center is now going to decide, and it will reduce the sympathetic outflow. It will reduce the sympathetic outflow to SA node. Reduce parasympathetic outflow to the SA node. So, as all of you know, that parasympathetic system actually suppresses the heart rate, right? So, if the parasympathetic outflow is going to get reduced, the heart rate will increase. As simple as that. So, the heart rate is going to increase. Even this stimulation of inferior cervical synthetic nucleus will lead to stimulation of the heart rate, but it is a minor pathway in this. The major pathway is this one, the vagal afferent. This is the major pathway. And stimulation of low pressure atrial receptors is also going to lead to release of a hormone called atrial natriuretic peptide, which will cause natriuresis and help in reducing the volume overload. So volume of the blood will be reduced because of this. Right? So in short, what exactly is Bainbridge reflex? You give some IV fluids, right? These IV fluids go inside your veins. All the veins are ultimately going inside the right atria. These right atrial fibers are going to stretch, right? And they are going to stimulate the low pressure atrial receptors inside the right atria. A minor pathway will go to inferior cervical sympathetic nucleus, right? Which will increase your sympathetic outflow. The major pathway will go via vagal afferent, right? Vagal afferent to the medullary cardiac center, right? Now, this medullary cardiac center is going to reduce the parasympathetic outflow to the SA node. Now, since the parasympathetic system actually suppresses the heart rate, reduced parasympathetic outflow means the heart rate will increase, right? So, if someone asks you in 2 lines, you will say that stretch of the right atrial fibers ultimately leading to tachycardia. If someone asks for the whole sequence, you can explain the whole sequence we discussed now, right? So hopefully this video help you in understanding what exactly is Bainbridge reflex. Okay, wish you all the very best. Thank you.